Do you have spine symptoms or spine pain and doctors are using terms that you don't understand? You just wish that you knew a little bit more about spinal anatomy so you could follow along? Well, that's what today is for. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and I'm fellowship trained in primary spine care. I've been managing patients with spine symptoms and spine injuries for over 2 decades now, and helping them understand their anatomy and these anatomy terms is really critical to their recovery. Please remember, these videos are for informational and educational purposes only. They are not a substitute for proper medical or chiropractic diagnosis, assessment, or treatment. Seeing the wrong provider can result in an incomplete diagnosis, poor recovery, or sadly even no recovery. So let's jump into this topic on spinal basics. So with spine anatomy, we've got a 4-part video series here. We're talking about the individual pieces of the puzzle. We're talking about each region of the spine as part of the puzzle. And then we're talking about the full spine model, and that's what we're going to do today. So before I jump in, I wanted to share with you a research study that's really intriguing. A group of researchers studied low back surgery, and these were surgeons. They looked at low back surgery that failed, and they tried to find what was the common result of between all these patients that had failure. What they found was neck deformity was the biggest predictor of low back surgery failure. So let me repeat this again. In the last video, we talked about how your spine has got all these different sections. You've got the neck, which is the cervical spine, the thoracic that has the ribs attached to it, and they're not pictured here on my model, and then the low back, and then the tailbone or the sacrum. The single biggest predictor for low back surgery failure in this study was problems upstream. How is that possible? You know, oftentimes we wonder, well, why would somebody be looking at my neck to work on my lower back or vice versa? Well, the reality is the spine is one continuous organ. You know, it's a lot like a bunch of gears that all mesh together. And then there's an electrical system, a computer system that coordinates one to the other. So anytime you have a disruption up here, you can have a disruption down here. So if you're dealing with spine problems that aren't getting better, say symptoms up here, if you're not getting better, sometimes you need to look downstream. So the whole spine model is how the body works. If you think about an athlete, their whole spine has to bend and twist. The whole spine functions together mechanically as a unit. Now, let's take a look a little bit further. The tailbone is anchored here in the pelvis, and here are the hips. There are also problems with hips that can turn into problems in the spine. So the spine does not function so the low back does not function in isolation from the neck, nor does the neck in isolation from the mid back. But get this, the spine as an entire organ system functions in conjunction with the hips, with the knees, and with the ankles. I want you to imagine, for example, somebody having an ankle problem. When they walk down the hallway, you don't even have to be a doctor. You know that something is wrong. Their whole body, the way that they move is different. If somebody has a leg and they're limping, you can see that their whole spine will sway side to side. Just watch it sometime when you go to the mall. You can identify that somebody has got a movement problem somewhere in the body. Sometimes you'll look at that and you'll be very clear. You know, that person has a neck problem. They can't turn their neck. So what do? They rotate their entire body. Or somebody might have a hip problem, and you can tell because they won't swing that hip. So their whole body has to turn. They're using their arms to pull themselves. So at the end of the day, the spine works as one continuous organ system. As doctors, it's our job to look at the individual levels, understand the individual anatomy. It's helpful for you as a patient to understand the individual anatomy. But really, in day-to-day activity and as part of a rehabilitative recovery effort, you need to integrate all these different areas together, and you need to gradually step out further and further and take a more and more larger picture view to figure out how to rehabilitate one area into the other. I hope you found this video helpful. I hope you understand the interconnectedness of the neck with the lower back, with the hips, and how this works as a whole spine model. I hope you found this video informational and educational, and I wish you all the best on your journey forward. You have a lot of videos to pick from. I'm honored that you chose this one. And until we meet again, have a blessed day.